Hello everyone, welcome to our channel. Today we're diving into a critical health topic, proteinuria. Specifically, we're going to discuss 6 dangerous foods that can increase proteinuria and wreak havoc on your kidneys. Proteinuria, or the presence of excess protein in the urine, can show up differently, ranging from subtle signs to more severe symptoms. It's essential to be aware of these indicators, as they can serve as early warning signs of underlying kidney problems. For those at risk of or currently experiencing proteinuria, it is essential to make dietary and lifestyle changes that support kidney health. Regular monitoring and proactive management can significantly improve outcomes. But first, let's understand the 4 types of proteinuria and their signs and symptoms. In this comprehensive guide, we also learn the causes and risk factors like biological factors, environmental factors, and lifestyle factors. Let's begin with 4 types of proteinuria. 1. Glomerular proteinuria. Glomerular proteinuria is a serious type of proteinuria that occurs when the tiny kidneys filtered, called glomeruli, are damaged. In healthy kidneys, the glomeruli act like a barrier, allowing waste products and water to pass through, keeping larger molecules like proteins inside. However, when the glomeruli are damaged, this barrier breaks down, causing too much protein to leak into the urine. This is known as glomerular proteinuria. Conditions like diabetes, high blood pressure, and certain autoimmune disorders where the body attacks its glomeruli can all lead to glomerular damage and proteinuria. Glomerular proteinuria is concerning because the kidneys aren't working properly and could sustain further damage. If left untreated, it can progress to chronic kidney disease or even kidney failure. 2. Tubular proteinuria. Tubular proteinuria is a type of proteinuria that occurs when the tubules in the kidneys are damaged. The tubules have an important job reabsorbing nutrients, proteins, and other molecules that were initially filtered out by the glomeruli. When the tubules are impaired, they cannot properly reabsorb these proteins, causing excessive protein to be excreted in the urine. This is tubular proteinuria. There are a few main causes of tubular damage leading to this condition: interstitial nephritis, inflammation in the spaces between the tubules that disrupt their function. Certain medications, some drugs like chemotherapy, antibiotics, and long-term SED use can be toxic to the tubules. 3. Overflow proteinuria. Overflow proteinuria is a type of proteinuria that occurs when there is an overproduction of proteins in the body, overwhelming the kidney's ability to reabsorb them all. Unlike other forms of proteinuria caused by kidney damage, overflow proteinuria happens because of an excessive amount of proteins produced, not due to a problem with the kidneys. One major condition that can lead to overflow proteinuria is multiple myeloma, a cancer of plasma cells in the bone marrow. In multiple myeloma, the abnormal plasma cells make too much of a protein called monoclonal immunoglobulin, M protein. When M protein levels get too high, the kidneys cannot reabsorb it all, so it spills into the urine. Other disorders like leukemia, lymphoma, and some autoimmune diseases where there is an overproduction of antibodies, immunoglobulins, can also potentially cause overflow proteinuria. For postrenal proteinuria is a type of proteinuria that happens because of problems in the lower urinary tract, not the kidneys themselves. With this condition, protein leaks into the urine due to issues like infections or cancers in areas outside the kidneys, such as the ureters, bladder, or urethra. A common cause of postrenal proteinuria is a urinary tract infection, UTI. When bacteria infect and inflame these areas, it can disrupt urine flow and allow the protein to leak out. Other potential causes include cancers, malignancies in the urinary tract, stones in the ureters or bladder. Unlike other forms of proteinuria from kidney problems, postrenal proteinuria results from something blocking or irritating the urinary tract downstream from the kidneys. It's important to identify this type correctly. For example, a UTI causing postrenal proteinuria would require antibiotic treatment to clear the infection. If cancer is the underlying cause, more intensive treatment like surgery may be needed. Common symptoms: foamy urine. One of the most noticeable signs of proteinuria is foamy or frothy urine. This occurs because the excess protein in the urine acts like a surfactant, causing bubbles to form when agitated. Swelling. Proteinuria can lead to fluid retention, which can cause swelling, also known as edema. This swelling is often most noticeable in the hands, feet, and face. Fatigue. As kidney function becomes impaired, waste products can build up in the body, leading to feelings of fatigue and lethargy. Weight gain. Sudden, unexplained weight gain can be a sign of fluid retention caused by proteinuria and kidney dysfunction. Uncommon symptoms: blood and urine. In some cases, proteinuria may be accompanied by hematuria, which is the presence of blood in the urine. This can indicate more severe kidney damage. High blood pressure. Proteinuria and kidney disease can lead to an increase in blood pressure, but high blood pressure can also contribute to kidney damage, creating a vicious cycle. Frequent urination. As the kidneys become less efficient, individuals may experience an increased need to urinate, particularly at night. Nocturia. It's important to note that proteinuria itself may not cause any noticeable symptoms, especially in the early stages. Regular urine testing is crucial for detecting elevated protein levels before they progress and lead to more severe complications. Early detection and management of proteinuria can help prevent further kidney damage and improve overall kidney health outcomes. Now let us proceed to the causes and risk factors. 1. Biological factors. Some key biological risk factors that increase the chances of developing proteinuria are genetics and age, factors that are essentially out of our control. Genetics. Having a family history of kidney disease puts you at higher risk of proteinuria. Certain inherited kidney conditions like polycystic kidney disease can predispose you to protein spillage. Age. As we get older, our kidneys naturally start to lose some functionality. The gradual loss of nephrons, kidney filters, with age makes it harder to properly filter out protein. While you can't change these biological factors, being aware of them is important. Those with a genetic predisposition or advancing age need to be extra vigilant about kidney health. For these higher risk groups, steps like regular kidney function testing, routine screening for proteinuria, and making lifestyle changes like diet and exercise have become even more crucial. Catching proteinuria early through proactive monitoring gives the best chance at intervention to slow kidney damage progression. 2. Environmental factors. Certain environmental exposures can also increase your risk of developing proteinuria by damaging the kidneys. Two key factors are toxin exposure. Chemicals, heavy metals, and other toxic substances can injure the kidneys. Examples include cadmium from industrial processes, organic solvents, and contaminated water. Prolonged exposure over time leads to kidney damage and potential protein spillage. Infections, chronic or recurring infections, can cause inflammation in the kidneys. This inflammation disrupts the kidney's filtering ability, allowing protein leakage. Problematic infections include UTIs, HIV, hepatitis B, C, and other bacterial to viral infections. To reduce these environmental risks, those with occupational toxin exposures need proper safety gear. promptly treating any infections is crucial to prevent kidney complications. Being aware of potential toxins in water, food, etc., and minimizing exposures. 3. Lifestyle factors. The lifestyle choices you make can directly impact your chances of developing proteinuria. Key risk factors include poor diet, eating foods high in sodium, saturated HTTPS sites. Google. All of these conditions strain and damage the kidneys over time. Lack of exercise. Living a sedentary lifestyle with little physical activity increases obesity risk. Obesity then raises the risk of high blood pressure and type 2 diabetes. These issues can impair kidney function and lead to protein spillage. Smoking. Chemicals in tobacco smoke harm the kidneys in multiple ways. Smoking increases blood pressure levels. It cuts blood and oxygen to the kidneys. The smoke also promotes inflammation, causing kidney injury. To reduce these lifestyle risks, maintain a balanced, nutrient-rich diet low in harmful substances. Get regular exercise to stay active and keep weight in check. Completely avoid all tobacco products and secondhand smoke. Let's proceed to the 6 dangerous foods that increase proteinuria and destroy your kidneys. 1. Salt and sodium-rich foods. Salt and sodium-rich foods can be extremely damaging to your kidneys. Eating too much sodium directly increases blood pressure levels. High blood pressure then forces the kidneys to work harder to filter the body's blood supply properly. Over time, this excess strain can lead to kidney damage or failure. Sodium also causes the body to retain more fluid. This fluid buildup further inflames and injures the nephrons, which are the tiny filtering units inside the kidneys. For people with chronic kidney disease or CKD, limiting sodium intake is crucial. For those with CKD, limiting total daily sodium to under 300 mg is recommended. However, dropping sodium levels to around 500 mg per day is ideal for preserving remaining kidney function. Key tips include checking nutrition labels, avoiding processed packaged foods, reducing the use of salt at the table, and finding low or no sodium seasoning alternatives. Taking sodium seriously and making smart dietary choices can go a long way in preventing permanent kidney damage. 2. Excessive protein. Eating too much protein, especially from sources like red meat and protein supplements, can put a major strain on your kidneys. When you consume protein, it gets broken down into waste products. Your kidneys then have to work harder to filter and expel these excess protein waste products from the body properly. This added workload on the kidneys from high protein intake can lead to 2 main issues: proteinuria and kidney stones. Proteinuria means having an abnormal amount of protein spilling into your urine because the kidneys can't filter it all out. Too much proteinuria is a sign of reduced kidney function. The other issue is kidney stones. The waste products from digesting a lot of protein, especially animal protein, can bind with other compounds in the kidneys to form hard mineral deposits called kidney stones. These stones can block urine flow, cause infections, and even lead to permanent kidney scarring or failure. For people with existing kidney disease, restricting protein intake becomes critically important to avoid further damaging their compromised kidneys. Dietary guidelines suggest limiting total protein to just 0.6 to 0.8 grams per kilogram of body weight for those with chronic kidney disease. 3. Banana. Bananas are very high in potassium. While potassium is an essential mineral for functions like muscle contractions, too much potassium can be problematic for people with kidney disease. the kidneys filter out extra potassium from the blood. But when you have chronic kidney disease, CKD, the kidneys cannot properly remove potassium anymore. This allows potassium levels to build up, causing a condition called hyperkalemia or high potassium in the blood. Having too much potassium is dangerous because it can disrupt important electrical signals that control functions like heart rhythms. Uncontrolled hyperkalemia can lead to complications like irregular heartbeat, muscle weakness, and even paralysis in severe cases. A single large banana contains over 400 milligrams of potassium, which is around 12% of the recommended daily amount for healthy adults. But for those with CKD, one banana could make up over 20% of their individualized, restricted potassium limit. This doesn't mean bananas should be completely avoided for kidney disease patients. But their high potassium content is a concern. Limiting portions to just half a banana and working closely with a renal dietitian is advisable to prevent issues from excessive potassium intake. 4. Drinking excessive alcohol. Drinking excessive amounts of alcohol can seriously damage your kidneys in a few different ways. First, alcohol is a diuretic that causes dehydration and increased fluid loss from the body. This dehydrating effect forces the kidneys to work harder to concentrate and expel alcohol waste products properly. But alcohol doesn't just dehydrate you, it can also directly injure and inflame the delicate filtering structures inside the kidneys. With heavy, long-term alcohol use, alcohol and its metabolites basically start marinating in the kidneys, causing oxidative damage to the renal tubules and other components that filter blood. This alcohol-induced kidney injury impairs the kidney's ability to properly filter out protein and other waste products. Protein then starts spilling out into the urine in abnormal amounts, which is a condition called proteinuria. Persistent proteinuria itself can promote further kidney decline. Numerous studies have clearly linked heavy, chronic alcohol consumption to an increased prevalence of chronic kidney disease, CKD, and faster progression of existing CKD. While moderate drinking may be okay for some, anyone with any level of kidney dysfunction should completely abstain from alcohol to avoid compounding damage. Protecting your kidneys by limiting alcohol intake is extremely important. The dehydrating effects combined with alcohol's direct toxic effects on kidney filters can initiate or accelerate kidney disease if alcohol abuse continues unchecked over time. 5. Dairy products. Dairy products like milk, cheese, and yogurt are high in protein, especially from animal sources like dairy, can strain your kidneys. For people with existing kidney disease or decreased kidney function, limiting protein intake from dairy and other sources becomes really important. All that extra work from metabolizing high amounts of dairy protein can accelerate further kidney impairment and damage. But there's another factor to consider with dairy foods: the milk sugar lactose. Many people have difficulty properly digesting lactose, which is known as lactose intolerance. For those with lactose malabsorption issues, consuming dairy products can lead to symptoms like bloating, gas, and diarrhea. If the diarrhea from lactose intolerance becomes severe enough, it can potentially cause dehydration and electrolyte imbalances that put extra strain on the kidneys over time. Lactose intolerance has also been linked to an increased risk of developing kidney stones. While dairy may not directly cause kidney disease for most people, the high protein content combined with potential lactose digestion issues means those with kidney problems need to be cautious about over-consuming dairy products. Paying attention to dairy intake, along with staying hydrated, may help protect remaining kidney function for those already dealing with impairment. Avoiding excessive dairy prevents overworking the kidneys. 6. Fried and fast foods. Fried and fast foods are extremely damaging to your kidneys. These foods are loaded with unhealthy fats and excessive amounts of sodium. The high levels of saturated and trans fats found in fried items promote inflammation throughout the body, including in the kidneys themselves. This chronic inflammation and oxidative stress directly damage the delicate filtering structures, nephrons, inside the kidneys that are responsible for cleaning the blood. Over time, the prolonged inflammation and oxidative stress from routinely eating fried foods rich in unhealthy fats leads to scarring and impaired kidney function. The excess sodium in fast foods is also a major issue, so the combination of pro-inflammatory fatty foods and sky-high sodium loads makes frequently indulging in fried and fast food a sure way to harm your kidneys long-term. Beyond just the direct kidney impacts, the poor nutritional value, fat, and sodium content of fried or fast foods promote obesity, diabetes, and other conditions that increase your risk of developing chronic kidney disease in the first place. For those with existing kidney issues, avoiding the drive-through as much as possible is advisable to prevent compounding damage. Thanks for watching. If you find this video helpful, don't forget to subscribe, like, and share this valuable information to help other people, especially those who have chronic kidney disease. Stay healthy and active. See you in my next video.